Well, hello everyone. It's a pleasure of being with you today, and I thank you for finding time out of your busy schedule for this presentation. And today I have the opportunity to talk with you about a 10-year program of applied prevention research we have implemented in Detroit with low-income Latino immigrants, Latinx Latino immigrants. And throughout the presentation, I will do my very best to communicate to you how is it that we have done activities in an effort to integrate science, culture, and social justice. I wouldn't be here today with the extraordinary of wonderful colleagues. We like to thank investigators, research consultants, interventionists, project managers, data collectors, community partners, people who have supported us in curriculum development. But above all, I would love to honor the parents who have taught us throughout these years how to best support their efforts. That's what we would like to acknowledge funding support that we have received over the years from the National Institute on Drug Abuse, National Institute on Mental Health. We'll also address the support of United States International Agency for National Development and Michigan State University. Currently, I am affiliated with the Steve Hicks School of Social Work at the University of Texas in Austin. But the work that I will present to you was supported by Michigan State throughout the 13 years that I was affiliated with Michigan State University. So as a starting conversation, for those of us engaged in mental health services, we can identify a permanent struggle. That permanent struggle is how is it that we inform our mental health services according to the best science, but particularly when working with diverse populations, how do we integrate and inform that science according to sound competence? And at the same time, we achieve sustainability and social justice. So I love this picture because it reflects the permanent tensions that we have. Sometimes we advance on the science, but then we start overlooking social justice considerations. Sometimes we advance on cultural competence, but then we start overlooking critical scientific considerations. So the presentation that I will share with you today describes the ways in which throughout the years we have tried to engage in these efforts by addressing all these dilemmas. Our program of applied research focuses on Latino immigrant families, Latinx Latino immigrant families. And why Latino populations? Well, my first motivation is I'm an immigrant myself from Mexico, so I have experienced many of the challenges that Latinx populations experience in this country. And at the same time, I resonate with what is the main motivator for being here in this country? What is the motivator for leaving your country and coming to the United States? And that is because we are pursuing a dream, right? We're pursuing a dream for our families. We're pursuing a dream that it was difficult for us to accomplish in our countries of origin. And everything we want is to contribute to this wonderful nation. However, one question we receive every night that we are in front of a parenting is this. They would say, parents would say, Ruben, something that we don't understand is that we do our best to offer the best to this country. We are right there when you need us in order to prepare food for you that you will enjoy. We are there helping you, having beautiful homes, and we're in the landscaping business. We're in the fields, even if there's pesticides, even if the conditions are too difficult. But why is it that we are rejected? Why is it that we are hated? And particularly in the current immigration climate, anti-immigration climate, Latinos have been identified as a scapegoat for long historical context that we have overlooked in terms of how essential Latinx populations have and continue to be for the advancement of this nation. So this is very hard when you're in front of a group of parents and they ask you this question: why is it that we try to do our best, we give so much to this country, but we're hated. As I was progressing in my program of research, I at the juncture of deciding whether to do clinical services research or prevention services research. And in my formation as a family therapist, I provide several years of in-home family services to ethnic minority families involved in the justice system. And although I was very effective in clinical processes such as managing and treating trauma, I was not effective at providing very concrete solutions to parents who were facing difficult parenting dilemmas. If a kid was and parents were overwhelmed by that and they realized they were about to start yelling to that kid or spanking that kid and, Ruben, what do we do? I realized I didn't have the tools to manage those type of situations. And that was when I came across the wonderful work by Marion Forgat and Gerald Patterson, at the time the Oregon Social Learning Center, as they developed the intervention that we know as parent-managed training, the Oregon model. But many of my colleagues, as I am a Latino researcher and interventionist, and I was serving Latinx families, they asked me, why is it that you want to do cultural adaptation? Isn't that a way of selling you out to those researchers who are in their majority are Euro-American white? Shouldn't we do more research from the trenches with Latino families? Is there a risk that we're going to engage in scientific imperialism? And I definitely agree with them that there's always this risk of not adhering to our Latino identity and Latino roots. But as you saw in the previous slide, it was very hard to see whenever I came across an adolescent in the justice system who was already acting out, and because the smoking of a few joints of marijuana was receiving harsh sentences. So the reality is, if you're a youth of color in this country, the odds continue to be against you, and you don't have as many opportunities to succeed. There's a saying in youth in the justice system, once you're part of the system, it's very difficult to get out of the system. That's why I said, as a young scholar, well, I need to focus on prevention to prevent these youth from engaging in this path in the justice system and prevent them from entering a system that needs so much improvement still in nowadays, and providing families with prevention tools, parenting tools that will increase the chances that youth will not walk that. So that was the first decision, is like clinical versus prevention research. And that's how I move into the direction of prevention. And prevention, applied prevention services research. It was my dream, not only to investigate, but also do it in a way that we could provide resources to communities. And that brought me to, for 13 years, I was affiliated with Michigan State University, but all my work centering the community in Detroit. Why Detroit? Because you see in this picture, the background reflects the challenges that a city of Detroit and many urban centers in the United States continue to experience. At the time, it was the time of the Depression. People were leaving the city, going to the city, and everything in Detroit was full of contextual challenges. However, you see in the forefront, which is what I really love, is a mural that depicts the strength of the Latino community. And that was what grounded our program of research. What we wanted to do was to culture adapt parenting programs for the Latino community from a prevention focus. So the idea was that these families were offering so much and continue to offer so much to us. And we would come in with providing them very specific tools and resources so they can enhance their parenting practices as a way of protecting their children. In the first step in our program of research was to make sure if we want to adapt an intervention that was originally developed for Euro-American population, sure it was relevant to Latino populations. And we started with a very large qualitative study, a study that involved 83 Latino. And one of the most dominant themes in this study was how parents talk about the discrimination they had experienced. As this father expressed, discrimination is a bitter drink that you need to swallow, because you say, if I get rebellious or do not behave, they can throw me into jail or they won't help me. So we learned that it was essential, particularly because we were adapting an intervention that was not originally developed for Latinos, to adapt the intervention according to the most relevant life experiences of this population. Another major theme referred to discipline, and because many of the families that we serve are mixed immigration status, this was a challenge for parents. Parents felt that they couldn't enhance and implement discipline skills because, for example, if they started to set limits with their children, these children, they already knew the citizen, and these children were US citizens, and they would say, for example, to their parents, well, don't talk to me like that. You cannot punish me severely because I'm going to call 911 and they can come and get you. And that's a very tough reality that these families were experiencing. But again, because we were implementing the qualitative study, we were able to identify those challenges. As this mother expressed, if I spank my kid, she cries and tells me she's calling 911. So I have to stop because they can take me and put me in jail. But at the same time, the qualitative study us to understand that for Latino parents, foreign-born Latino parents, the issue of culture was very clear. Latino values is to instill in your children to be respectful of others. It goes in the blood what your parents teach you. So as we knew we were facing very salient cultural and contextual challenges, we also knew that in this population, we had access to these powerful cultural strengths, and we had to build from those as we were adapting the parenting intervention. At that time, the National Institute of Mental Health was very interested in a model of cultural adaptation. We have already presented that we were informing our study according to a qualitative study to reflect the life experiences of parents. But then they were also very interested in to what level, different levels of cultural adaptation make a difference. Our main premise to the National Institute of Mental Health was that we wanted to empirically what happens if you adapt with different levels of adaptation the same parenting intervention. Our study wanted to test implementation feasibility. That is, can we engage parents? Can they attend the sessions? Can we retain them in the sessions? But it's not necessary, it's not sufficient only for parents to show up and remain in the intervention. You need to show that the intervention makes a difference. And basically, this is the first prevention study that we implemented. And parents who were willing to participate in the intervention had a child between the ages of 4 and 12. The children have to have low to moderate behavioral problems because this was a prevention study. So we had to screen out any children whose parents were engaged in very serious problems like setting fires, consistently hitting pets, and examples of behavior like that. So it was a prevention study in which we will deliver the parenting program only to parents, because according to PMTO, there's a mediation model that states that if you enhance the parenting skills of parents, you will see a reflection of that improvement in the behavior by children. So when parents express a commitment and an interest to participate in the program, they were randomly allocated either a CAPAS intervention that we call is a name for the translated version of PMTO, CAPAS Enhance, or waitlist. So let me explain what each of these interventions look like. The CAPAS, for its name in Spanish, that it's promoting harmony and self-improvement in children, was basically focused on parenting components. You can see here, all the components of the intervention are exclusively focused on the original PMTO components. That is, you start by helping parents refining how they directions to children. Then you move to encouraging children by motivating good behavior. And then you move to topics such as limit setting and monitoring and problem solving. The CAPAS took a different approach. Started with a focus session in which parents were invited to talk about their experiences as immigrants, their challenges as immigrants, and the resources they needed as immigrants. Then at the end, we had the topic of parenting between two cultures that talks about of having bicultural families. That is, in many of these families, we're expressing, for example, children would express a preference for speaking English compared to the Spanish that parents embrace. And that can generate conflicts. So that component focus on giving tools to families about how to manage those type of conflicts. And throughout the intervention, you see that every parenting component would be informed according to the life experiences of parents. So for example, in limit setting, which is a very difficult parenting practice to implement that requires a lot of emotional regulations, we would first talk with parents that before practicing limit skills, they need to identify their level of stress. These are parents who were exposed to very harsh treatment by employers. There were parents that would report they would work 10 hours, but would get paid 6 hours and got threatened. Employers calling immigration, or if they wanted to complain. Mothers, for example, would experience social isolation. So we would really address these issues before going into any issues of the parenting skills. And once parents would communicate the stressors of their life related to immigration, we would engage with them in strategies to manage those stressors, and then we would address the parenting skills. So in the CAPAS enhanced intervention, issues of culture, issues of context are purposefully addressed. In the CAPAS intervention, we would address them if parents raise the issues. And finally, a third group of parents was allocated to a control group that they had to wait until we completed all these interventions and measurements to receive the intervention. So we could compare and contrast the impact. Every parent that expressed a desire to participate in intervention would get the intervention, but it was in different modalities that they were exposed to it. As I mentioned to you, this was a prevention study with families with small children. And as I mentioned, the CAPAS exclusively focused on parenting components, and CAPAS enhanced parenting components with a very overt focus on culture and context. The parenting literature indicates that the engagement and retention of parents in voluntary prevention interventions, parenting prevention interventions, is usually hard. And we were very pleased with these findings because the engagement rates that are reported in the literature fluctuate all the way from 30% to 70, 75%. The retention of our families at follow-up was 86. And we were very pleased that in 80% of the families, it was integrated by mothers and fathers who participated, and we were able to retain 85% retention rate. Overall, parents in both interventions were highly satisfied. And these are summarized in these graphics. As you can see in the graph on the left, those are the changes in parenting outcomes. Basically, what we found was that parents both allocated to CAPAS and CAPAS Enhanced significantly improved their parenting practices compared to parents that were in the waitlist control. That is good news in terms of the intervention being relevant to both groups of parents, and indicates to us that the core components of the intervention is highly relevant, even if you don't have time to address everything within immigration frameworks. However, we were very, very intrigued about what's the impact if in one intervention you address oppression, discrimination, and the other one you do not. And what we found was very interesting. What we found, as you can see in the graph on your right, was that child internalizing and externalizing behaviors for families that participated in CAPAS Enhanced significantly improve, even more than CAPAS and control. Internalizing behaviors, children feeling afraid, feeling sad. Externalizing behaviors, children acting out, oppositional behaviors. So these findings indicated to us that when you overly address discrimination, when you overly address cultural challenges, there's going to be an incremental effect compared when you do not. Even though parenting all parents improve their parenting practices, the ultimate indicator of differential impact is reflected in the kids. When we talk with families, we wanted to understand what was that difference about. And families provided really nice narratives in which they said, well, you know, the thing is that when you have time to talk about oppression and discrimination, and you get home and you will feel very desperate, you really want to take it on your kid because it's the person that you have closest to you. But the intervention really helped us to identify all the stress I was carrying and be ready to engage in a parenting situation by regulating myself. Mothers would say, for example, that they would be yelling at a lot of their kids and that their kids would go to corners. It would just be sad because they were criticized by them. So as we reflected on these findings, we were able to understand that the incremental effect of attention is that parents can contextualize their parenting experience in more profound ways. And as I was mentioning, we found common and contrasting qualitative findings. For example, I learned that I was the one who had to change rather than expecting my child to change. My son would approach me and I would evade him. Now he approaches me and I express my love to him. This is a powerful statement because in the intervention, you never tell parents you're doing things wrong. You say, tell me how you're doing things at home. And we say, okay, let's do things in a different way. So you engage parents in role plays. So this insight by this mother that said, I was the one who had to change my parenting was very profound because you facilitate a process in which parents experience different parenting situations and they get to their own conclusions. Learning how to discipline my kid has helped me because I can use authority but without hurting him. And this goes along some of those findings that I was sharing with you in terms of parents relying on very harsh parenting practices. But as a result of processing their cumulative and practicing these skills before implementing them with their children, they were able to see those changes. Now, those are the findings related to parenting. But I love this picture as it depicts that culture cures. And for all of us engaged in clinical services, prevention services, we have two major take-home messages. The first one is the previous slides and previous quotes indicates that evidence-based parenting interventions really help us to parenting skills grounded in empirical findings and empirical premises, and they really have a beneficial impact on families. However, it is very important working with diverse population, particularly exposed to harsh contextual realities, to thoroughly inform evidence-based interventions according to culture and context. For example, this participant said, I would like to learn how to talk to children about racism because in many occasions, my children have suffered racism. Just because they have Hispanic accent, they have experienced racism. The regional parent training models talk about these issues, but this was something that we embedded in our parenting interventions because guess what? You get home, you've been called a wetback, you've been called an illegal immigrant during the day. You have experienced racism. And if you don't process that racism yourself, it's going to permeate in the way you parent. And your children will also experience racism. And how is it that you're going to respond to that? So this was very important because it was expressed by one of the parents in the CAPAS Enhance intervention, so indicating to us that it was very relevant addressing parenting issues, but it was also highly relevant of addressing cultural and contextual issues. I thought that my children were going to grow and think like I do as a Mexican, but then I realized that they are growing up here. Their minds are different. If I only teach them what I learned in Mexico, I will not offer them a good education. I need to learn how to raise them in a new way by also adapting to this culture. This slide really reflects the last theme of the CAPAS Enhance intervention, focus on biculturalism. As I was mentioning, families, there's a risk for families to experience cultural conflicts. And this quote is very powerful because foreign-born Latino parents realize that their children will not grow as they ideally wish they would have grown in their countries of origin. And they need to come at a place of negotiating, being at ease with that, without giving up on what they want to transmit about Latino cultural values, but also learning about what's extremely valuable to their children. And these qualitative findings help us understood that that last component of the intervention was particularly relevant. As a result of this experience and the successful outcomes we received, we were supported by the National Institute on Drug Abuse to expand our program of research and the cultural adaptation of this parenting intervention to families with adolescent children, as our NIMH study was focused on children ages 4 through 12. As we implemented this study, we had learned about the lessons of the differential design. So we decided to focus overtly in this intervention on issues of discrimination and biculturalism, particularly now that the anti-immigration narratives throughout the United States have really increased in intensity. And we also included an advocacy approach in which we approach his family and ask them, what do you need? Do you need food stamps? Do you need referrals to other types of jobs? Because the job situation you're experiencing. And we provided that support to families. We are very happy to report that our retention was very high in this study, 87%. Families exposed to the intervention were very satisfied. And as I speak, I just received a couple of days ago our findings, and we're thrilled because all the parenting outcomes improved substantially in the intervention group, and youth internalizing and youth externalizing also decreased substantially. So we continue to see the same pattern from the NIMH study. However, we also found new data that we had not seen before. And I want to go to this discrimination data, which is something that we were not expecting in the intensity that parents reported. My son was bullied by classmates at school because I'm an immigrant. It got to the point of him saying that he wanted to die. We suffer by being immigrants, but our children suffer even more. When we talk about this, my son tells me, Mom, I know you came here to offer us a better future. This finding, at least we had 2 reports of suicidal ideation for bullying, related to bullying, in which adolescent children in these families were bullied because their parents were immigrants. It's like kids at school saying, well, we're building a wall, you need to go back, and your parents are wetbacks. And at least in these couple of cases, it got these young adolescents to experience suicidal ideation. This was a type of data we had not collected before, we had not seen before, but is closely tied to the current immigration climate we're experiencing. And it leads you to understand the importance that it's not enough only to do parenting intervention and offer parenting interventions in a vacuum, right? Not only in parenting practices, but that these families, these kids, live in contexts that are hostile, and we need to adapt that accordingly. At the same time, we continue to see this theme of cultural conflicts. Our children have lived all their lives here, and we want to educate them like we were raised. We live in 2 cultures, and we need to find a way to keep both cultures as we raise our kids. This finding is very important because back in the 80s, the group of researchers at University of Miami, they found evidence for what is called the acculturation gap hypothesis, that says that if families get entrenched in these cultural conflicts, adolescents may feel alienated in their family and may start reaching out to other adolescents who may feel also rejected. And that can be a risk factor for drug use, early drug use. So the issue of cultural conflict is within the family, and it can be a precursor for early initiation of drug use. So it's extremely important to address that within the parenting intervention. And in our current intervention is something that we overtly address. So when we think about prevention intervention, clinical intervention, not only have the parenting domains that you need to address, but you also have the cultural conflicts domains And for example, parents wanted their kids to speak more Spanish, to align more themselves with cultural values, whereas their kids are growing up in a context that they may not be having that, particularly if they live in contexts that Latino population density is not high. And at the same time now, we have the challenge of how is it that we have that we overtly address discrimination in the interventions that we are implementing. And as I was mentioning, this is a new type of data also that we have not seen before. After talking with my daughter about immigration, she told me, "Mom, I'm going to be a social worker when I grow up. There are too many injustices against Latinos in this country. I want to help." This is a challenging quote because you think that these adolescents shouldn't be worrying about these issues, shouldn't be experiencing this rejection, right? It's like adolescents should be adolescents. But this adolescent was forced to face a reality of rejection that is impacting her, her family, and Latinx communities. But at the same time, embedded in that challenge, you see that this adolescent is embracing resilience. It's like, I want to fight back. I want to defend our people. I want to do something about it. And this duality of data is something that we have not seen before. As we engage in prevention services, in clinical services with families, we need to be cognizant of all these issues, of the parenting skills we need to communicate and help parents enhance. We need to be aware of the cultural conflicts, but we also need to be aware of the contextual challenges, but also the ways in which families are developing resilience to address those challenges. So in closing, what are the major lessons of this work? Well, first, none of what I have presented to you today would have been possible without the amazing leadership of our community professionals. Our data was collected by people from the community who really know in depth the challenges of the community. Our interventionists were a magnificent team of clinical social workers and community organizers who knew the community very well. Our job was to train them in the interventions, but they did a beautiful job of embracing the intervention and translating it for the community. So first and foremost, the community professionals we had. And as I mentioned, none of this would have been possible without the extraordinary parents who kept us learning, kept us inform about their life experiences and help us learn about the best way in which we can support them. At the same time, we have learned that it's not enough to culture adapt an evidence-based intervention according to its main premise, in this case, improving parenting practices, without overtly addressing issues of oppression and discrimination. The more we work with populations who are exposed to cultural and contextual challenges, it is an ethical mandate now that we have to overtly address how oppression and discrimination is impacting them. At the same time, we learned that if we had only focused on cultural and contextual issues without adhering to the fidelity of the intervention, as it refers to what are the principles that account for efficacy of interventions and promote a change in families, we would not have gotten the results we got. Parents need very specific tools when they are moving away from parenting styles that are more punitive towards parenting styles that are more nurturing and are focusing on promoting and celebrating the accomplishments of their children. And we have also learned that the advocacy component is very important, is to have extra ways of supporting families in the contextual challenges that they're experiencing. If families don't have food to eat, if families don't have a job, it's going to be very difficult that they will participate in a parenting program, that they will remain in the parenting program, or that they will remain engaged, fully engaged in the parenting program. So with that, I would like to thank you. This is has been a fascinating journey that we have experienced. I want to honor all your efforts in the community, being as a researcher, as a clinician, mental health provider, or a combination of all the above. And hopefully these lessons that we'll learn will help you in your journey as you work with diverse populations who continue to be exposed to significant challenges. As the closing of the movie Rango which is a beautiful cartoon that I highly recommend, says, it's not about us, it's about them. So we owe all these efforts and the commitment to do our work better to the communities that are waiting for our support, as they offer us so much to us in our everyday lives. And would like to thank you for everything you offer to them in return.